Good morning here in Colorado, everybody and everywhere where you're connecting this morning. Welcome again to another UCAR Africa Initiative seminar. My name is Ana del Moral Mendez, and I am part of the UCAR Africa Initiative, working here at the Earth Observing Laboratory in NSF at NSF NCAR. Today we'll be hosting the session titled KEMRI, Air Pollution Center for Excellence, a catalyst for improving health in Sub-Saharan Africa. And our speakers today, we have a group of speakers that are part of the Kenya Medical Research Institute, or KEMRI, University of Liverpool Air Population Center for Excellence. So first, let me introduce you to Charles Muruka, a public health and project management specialist who has worked with international NGOs and led a diverse range of public health programs. He is currently a PhD fellow at KEMRI, and his research focuses on policy analysis on clean household energy in Kenya. We also have with us Nancy Chebichii, is a researcher at KEMRI. She's dedicated to integrating climate change adaptation interventions, addressing the significant global health concern of household air pollution with a focus on science, policy interface, communities empowerment, and collaborative solutions for health, environment, and sustainability. She leads the health system strengthening and capacity building and community engagement and involvement within the NIHR Global Health Research Unit, Clean Air Africa. So we also have with us Gohole Akaranga Arthur. He's a distinguished researcher and advocate for environmental health and sustainable energy. He currently serves as a research coordinator and scientist at KEMRI, where he also manages the Air Pollution Center for Excellence. His research is centered in advocating the development and monitoring of databases that track air pollution, climate change, and sustainable energy solutions, with a particular focus on their interconnections with health indicators in resource-poor households, especially in urban informal settlements and rural areas. Fourth speaker will be Betty Koech. She is a research scientist at KEMRI dedicated to addressing the significant global health concern of household air pollution. She is also the field workers coordinator for KEMRI and the Clean Air Africa project, as well as the acting laboratory manager for air quality analysis. She has several years of experience in molecular biology, immunology, virology, bacteriology, academia, community engagement and involvement, and fieldwork coordination. Betty's previous research was on the prevalence dengue fever virus in the adult Kenyan population. And finally, we have Dr. Mwitari. He's a long-serving public health practitioner with over 30 years of experience in public health, with substantial expertise in teaching, research, and leadership. He's currently working for KEMRI Clean Air Africa Global Health Research Unit as a co-director and senior research fellow, as well as the director of the newly established KEMRI Center for Excellence. He was formerly the dean at the School of Public Health and senior lecturer in the Department of Health Systems at Amref International University. He's worked in various departments within the Kenyan Ministry of Health, and as well as the Ministry of Planning and National Development. And he now leads the several international research projects on air pollution, energy, global public health, and is currently one of the 14 experts appointed by the Africa CDC to support in the development of African continental climate change and health strategy. So to our speakers, we are really pleased to have you today presenting your work. Thank you so much for being here with us today. And just as a quick reminder, you will have about 45 to 50 minutes to present your work, to allow later for some questions for the audience and to get like some feedback and possibly collaborations in the future. And for all of those in the audience joining us today, you can submit your questions for the KEMRI team through Slido. And we will read those questions during the Q&A at the end of the session. So please welcome all, and to our speakers, the floor is all yours.
Yeah, that's KEMRI. Let me take you through 3 institutions First is KEMRI, that is Kenya Medical Research Institute, and as well as also Clean Air Africa. And then now I zero down into also taking you through what our Air Pollution Center of Excellence is all about. Let me start out with the KEMRI, because KEMRI is the one which is hosting both Clean Air Africa project, as well as also hosting the Air Pollution Center of Excellence. Now, in a quick brief, Kenya Medical Research Institute is one of the parastatals of the Ministry of Health, which was established 45 years ago through an act of Parliament, which is the NACOSTI Act of 2013. And this institution, actually, as we are talking now, it's one of the leading centers of excellence in health research, both in Africa and even also globally. In respect to the staff or the personnel that are in this center or this institute, we have currently 15 research centers which are spread across the country. And these centers are well staffed with the state-of-art research facilities and also laboratories. They are served also with over 4,000 technical staff who are researchers or research scientists across the country, distributed in those 15 centers. And one of the centers is the center where we are, which is the Center for Respiratory Disease Research. As I put it again, I want to repeat and say that this center is ranked among the top research institutions in Africa in terms of research output. The slides are not moving. Now, that is all about KEMRI. Now, in regard to Clean Air Africa, Clean Air Africa is basically a consortium, and it's a consortium that was established in 2016. It's a consortium of partners from academic, research, and clinical institutions from the UK, Cameroon, we are particularly in the Duare Hospital. Then in Kenya, we are in Kenya Medical Research Institute, as well as also Moi University, School of Public Health. And then in Tanzania, we are in Dar es Salaam University, Department of Behavioral Sciences. In Rwanda, we are in Rwanda Medical Center, and Uganda, we are in Makerere University Lung Institute. We are also collaborating now with the government and non-governmental organizations in those countries. And the ministries we work with mainly are Ministry of Energy, Ministry of Environment, and Health. But what we collaborate with all these partners because what we collaborate to do is to provide or generate evidence-based policies for adoption and the scale-up of clean cooking fuel towards, of course, achievement of selected and target sustainable development goals, particularly goal number 3, which is on health and well-being, goal number 7 on affordable and clean energy, and goal number 13 on on climate action, and goal number 17 on a partnership. Move on, the next slide. Still in the Center of Excellence, we now to explain or to tell you about this Center of Excellence in a very brief, way, because somebody else is going to talk with to give more details. Is this Air Pollution Center of Excellence is not serving only Kenya, but it's a Sub-Saharan Center of Excellence, which is meant to monitor air pollution and the prevention in Africa, those countries where we're working, and it's equipped with a state-of-art gravimetric filter weighing analysis robot, which is the only one in Africa. But also we have high technology or technical air quality monitors for that purpose. We also boast of having highly qualified experts on air quality and health, And our collaborators are mainly Bakare Air Monitoring Group in the US, then University of Liverpool in UK, Mesha Technology Laboratories in US, Ministries of Health in those countries, which I mentioned, and Columbia University, and then the World Organization. And recently, the First Lady's office here in Kenya. The next slide is about our interest as a center of excellence in terms of climate change and health and air pollution. We have noted currently that over 90% of the schools, or the data we have, and 76% of households in Kenya rely on polluting fuels, leaving a very small population of schools utilizing clean fuels, and very few households in Kenya that are using clean fuel. And this large proportional percentage of households and the schools utilizing polluting fuels normally utilize close to about 11.5 million tons of metric tons of wood, which is normally harvested from the forest, and these are the ones which is the firewood which normally used to serve the kitchens from the schools and also the households. Now, when this 11.5 million tons of wood is burnt, we have quantified and found that it ends up releasing 20.7 million tons of carbon dioxide, which is a greenhouse gas emitted to the environment or to the atmosphere. And this is what we see having a high likelihood of course, increasing the atmospheric warming. But more important is that when this wood is burned, what we have realized is that because we, as a center of excellence, we have taken quite many measurements across the country, we have found that particularly the health damaging pollutants, which is particulate matter 2.5 microns in diameter, and carbon monoxide, is actually the levels are 3 times, more than actually 3 times those ones that the levels that are set by WHO guidelines. And these high levels of pollutants are the ones which are responsible for the annual deaths of about 124 deaths per 100,000 population, translating to an annual death rate of, death of 67,000 in the country. But again, this 124 per that 100,000 is deaths due to ambient and also household air pollution. For household air pollution precisely is attributable to 26,300 deaths per year, which is about approximately 42 deaths per every 100,000 of population in Kenya. So this is what is making actually ourselves as a center of excellence to have a quite big interest in terms of climate change, air pollution, and health. Now, finally, the last slide which I want to show you is, because mine is just the overview, is to show you the staff that is working at the center of excellence. These are only the scientists. You can see there are around 16 of them, but remember we have also close to, I think we're not close, but we have 17 field workers who act as research assistants. So these are the scientists here range from microbiologists at your hand and trying to read their biodata. The medical doctors who are specialists in public health, Professor Were, others pediatricians like Dr. Amkoya, and then environmental officers are more in this group. And of course, we have even microbiologists, we have also biostatisticians. So at this point, this is the key stuff, but we have also stuff that we cannot say is not key, which is actually right in the field. So at this point, I want now to hand over to Akaranga to take us through now the next step, and then hand over to somebody else to take up to the last my honor that we are going to make this presentation today. Thank you.
Thank you very much, Dr. Mwitari. For the presentation you have just done, you could see that Kenya, we have been losing over 20,000 people annually. But for the few studies that were being done locally in the country to try and correlate the emissions level at household level to health, most researchers and scientists could face challenges whereby they were forced to send all their samples to the US for analysis, and that was not sustainable. And it could discourage most of the scientists who wanted to venture in this area. And in the end, informing policies became a problem. This is when this dream of coming up with the KEMRI Air Pollution Center of Excellence started. That was back in 2016 at the Ministry of Health. The journey has been long until 2022 when it was officially launched in Nairobi in collaboration with the University of Liverpool, where the funds were received from the UK NIHR. Next. The main focus of the center is to build a proper understanding and mitigating indoor air pollution and the research on health impact of indoor air pollution. The reason as to why we are focusing on indoor, because this is a mandate that has been given to the Ministry of Health of Kenya, whereby the ambient is being handled by the Ministry of Environment. However, there are those cross-cutting sections whereby these ministries, through national coordination mechanisms, are forced to work together. So by extension, we engage with the Ministry of Environment through its Department of Metrology and the National Environment Management Authority. The key features of the center include the advanced indoor air quality measurement technologies. We have training and research for health professionals and the students, and also we have data-driven policies for reducing indoor air pollution, not only in Kenya, but also in the Sub-Saharan Africa. Still more on the key features of the center, we have the advanced indoor air quality measurements technologies as recommended by the gold standards. We also have training and research for health professionals and students. Some of the data-driven policies for reducing indoor air pollution have included one of the policy statements which was produced during the COVID period, that was in 2020, for where tax was being introduced in one of the interventions which we are recommending can highly reduce indoor air pollution. And that included the use of biomass fuel, whereby increasing tax on LPG could have been the problem. We are also aligned to the WHO standards, and our laboratory has met all the US EPA standards, both for the gravimetric laboratory and the environment around. In terms of human resource, capacity has been built, and in the region, we can say that we have experts trained from all over the world, including University of Columbia, MTL, who are the ones who gave us the technology for gravimetric weighing, the MTL AH500E. Berkeley have been instrumental in giving us some of the technologies that we lacked here as a country, and also WHO in trying to build the coordination mechanism within the country for indoor air pollution. In terms of gold standards, we have gone further, whereby we are able to calibrate equipments locally here for key parameters or key pollutants for health impact, including the particulate matter, carbon monoxide, carbon dioxide, nitrogen oxide, and VOCs. We are also expanding to venture into climate change, whereby considering most pollutants within the household are considered short-lived climate change pollutants, we are mandated to support the Ministry of Health in generating evidence linking the two. Next. Some of the key pollutants that we are able to measure locally include the PM1, PM2.5, and PM10. These ones have been linked to low birth weight, respiratory tract infections, among others. And it has become one of the key indicators that the country has taken seriously to report on. And also, as a country, we have been losing a good number of people because of carbon monoxide. And we came to realize that the gaps that are there, the Ministry of Health has the mechanism to be able to address this. So from where we are standing, the center is able to provide that evidence that some of these deaths that are occurring abruptly in houses are linked directly to carbon monoxide. We have gone further to volatile organic pollutants, nitrogen oxide, black carbon, carbon dioxide, and stove use monitor, whereby we're able to link the stove usage characteristics to emissions level. In terms of the technologies that we have some of the advanced technologies. For the gravimetric we received from MTL, we are analyzing all the PM samples coming collected not only here within the country, but also in the neighboring countries such as Addis Ababa, Rwanda, and Cameroon. We are using the UPath version 2+ for collection of the samples, but we are also able to collect carbon monoxide, nitrogen oxide, and carbon dioxide. LASCAS is one of the technologies we are using also for collection of this carbon monoxide. The purple layers, this is we are using mostly for estimating the emissions level before we could undertake the recommended gold standard for gravimetric. This one, again, considering most of the equipments are based with institutions within Nairobi, and considering the country is full of, it has 47 counties, there is need to reach out to all these 47 counties to be able to reduce this disease burden. And for this, as a center, we have been encouraging also the use of the low-cost sensors such as monitors such as the purple air. The geosyn dots we are using to monitor the cooking characteristics, especially where there is stacking. Yes, transitioning from biomass is taking place, but in most cases you find stacking is a factor, and because of other socioeconomic contributors, you find people still stick to usage of biomass. We have gone further, trying to interlinking the emissions level to climate change and the disease burden. And for this, we have been able to acquire the microearth M200 for the black carbon, which so far we have been able to collect samples from across 9 counties in the country. Next, those are images of just some of the gadgets we are presenting. So the center is also supporting research. You have seen from the presentation, we are doing a lot of research in collaboration through the Clean Air Africa Research Group. We are also undertaking local research and survey tasked by the Ministry of Health, like the kitchen performance tests, among others. Through the kitchen performance tests, also we are able to come up with effective ventilation strategies as aligned by the national strategy for household air prevention strategy. And also, we are looking at household sources of indoor air pollution, not only limited from cooking and heating, but we are going further looking at the house designs, the paints, and all others. Next. The center to support requires a lot of partnership, especially when it comes to technology. You could see some of the chipsets and whatever it takes to produce some of the equipments. We lack as much as we have scientists who are able to produce this. So with this, we have partnered with the University of Liverpool, whereby together with KEMRI, they are co-directing the Clean Air Africa Research Group. And through the network, the center has been able to partner with other countries within the continent, including Rwanda, Uganda, Cameroon, and Tanzania. Measure Technology Laboratories are one of greatest supporters, considering they're the ones providing the technology for the gravimetric weighing through their latest technology. Bakali here has also been very instrumental in supporting us and acquiring the right technologies for personal air exposures. And with this, through them, we have been able to acquire the latest versions of UPAS version 2+, including support services such as calibration. GIZ NF, this is a German entity within the country, which is one of our partners. Also, we have been collaborating a lot in terms of coming up with the policies that the country is trying to produce in order, through the Ministry of Health, in order to manage the menace of air pollution. GeoHealth is also another research group within Africa, which has partnered with the center, which includes Columbia University, Addis Ababa University, University of Nairobi, among others. We have also Air Quality Systems East Africa, which is a platform or an entity that enables most institutions in the country to be able to acquire air quality monitors at ease. We also collaborating with the Mama Doing Good or the Office of the First Lady, which have been instrumental in building the communities and chamas, which directly reach the households. Then we have colleagues from Netherlands, the TNO, who have been instrumental in trying to model the histories in the country, trying to see how we can interlink the climate change history and the health impact. We are considering air pollution is an area which cannot be handled alone with the health sector. We are working, apart from being part of the Ministry of Health, we are working closely with the Ministry of Environment and Climate Change, whereby we are able to align also our measurements with the National Environment Management Authority Acts and also the Kenya Meteorological Department. We are also working with the Ministry of Energy and Petroleum, who are very instrumental in providing most of the interventions that we are recommending to reduce the emissions, and the Ministry of Education. These are some of our field activities that we do both at household and institution. Next. The center is very instrumental in supporting the Ministry of Health in coming up with policies and coordination. And we are doing that through the coordination of the Ministry of Health National Air Pollution, Energy and Health Technical Working Group, the Kenya Household Air Pollution Prevention Strategy 2024-2029, which is about to be launched soon. We have the Community Health Promoters Household Air Prevention Training, Module 14, which is one of the key training modules for the community health promoters. We are also part of the Climate Change and Health Technical Working Group, whereby the center at KEMRI has been mandated to coordinate the annual Kenya Health and Climate Change Conference. And with all that presentation, the center has been able to achieve several impacts. One of them being informing interventions to reduce air pollution in the Sub-Saharan region, training future experts in indoor air quality and health, reducing associated risk associated with air pollution within the country, and also build capacity for air quality monitoring in Kenya and other African countries, like in our partners in Rwanda, Tanzania, Uganda, and Cameroon. Thank you very much. And we also have, in terms of building the next pool of research scientists to be able to manage air pollution and health in the country, the center is also, through coordination with the graduate school under KEMRI, offering PhD training programs aimed at managing air pollution at household level and institution level. We have early career initiatives whereby students and those that have graduated are able to come and be mentored at the center. And in terms of professional development, especially when it comes to policy formulation, the center has been able to come up with the three main initiatives under the Clean Air Africa group. One of them being the health impact assessment, which is one of the mandates the Ministry of Health has been given under the Health Act 2020, the air quality, energy, climate change and health, and the health journalism and public health communication. This one was to be able to communicate effectively the issues of air pollution and health, considering the scientific interpretation by the journalists has always been a problem across the world. And we felt it's important to come up with this training to be able to bridge the gap. And the training is starting by 20th of January next year. That marks my end of the presentation. I welcome you, Nancy.
Awesome. Thank you so much, Arthur. Thank you, Dr. Mwitari. I will now proceed to just present the research activities that we're undertaking and capacity building. So currently, as earlier mentioned, that schools are the highest consumers of wood and not only contribute to climate change and also destruction of forests. And as Clean Air Africa, we are currently exploring school transition to clean cooking, not just for health and environment, but also for education. In this regard, we are looking at evaluating the impact of switching to clean energy on air pollution levels in the kitchens, classroom, and children's playfields, but also to understand the cognitive performance of learners' impact associated with air pollution. And lastly, we are also looking at understanding the enablers and the barriers of these interventions that support cleaner cooking in schools, from different technologies, from LPG to steam cooking to electricity interventions that have been undertaken in public institutions, and our main focus is currently in schools. We are also looking at how best do we then ensure communities are transitioning. We are looking at different models, and as earlier mentioned, we've supported the ministry in developing the Module 14, that is the Community Household Air Pollution Prevention Program that targets community health promoters. Community health promoters in this context are the interlink between the community and the health facilities, or rather the overall health system. They are the primary, that they serve at the lowest level of the health system tier at the community level. So the community health promoters are very instrumental in ensuring that health education is undertaken within the communities, either at the households or during community dialogue and action days. We are also exploring table banking-led education on household air pollution table app. This is a model that targets social groups that range from women social groups to mixed social groups to a whole range of social groups. We have currently started off by looking at women groups that are affiliated to Mama Doing Good, Office of the First Lady. And lastly, we are looking at, for the past few years, we've been able to train TOTs across Kenya. However, we've not been able to reach the target, and therefore exploring on digitalization of training and also reporting on household air pollution indicators. And lastly, just to mention other research activities that we are currently undertaking. One is a national baseline study that looks at the levels of air pollution, as my colleague had earlier mentioned, that we are looking at 9 counties in Kenya, and we've been able to collect data of different air pollution and stove usage, as well as health-related outcomes in Kenyan kitchen settings. These will look into developing a Kenyan kitchen that puts in consideration ventilation, air pollution measures, but also puts in consideration technologies used by the population. We're also looking at a baseline surveys on kitchen performance test amongst households. This was done and completed by the team, looking at technologies around firewood use, charcoal use, and kerosene use for cooking. We've also explored the potential benefits of cooking with LPG on environment, time, cost, and health in informal schools. And this was the study that further informed our current research activity that is now looking at schools. So this was an exploratory study, and we hope that the baseline, the nationwide baseline study would also inform a nationwide and a national and a sub-Saharan African study in matters climate change, health, and environment. And lastly, we've also been able to evaluate energy sufficient costs for household cooking in Kenya. As you may see, is that we've not only targeted to explore technology options for households and communities and institutions, but we also want to understand what other technologies can actually support this energy transition to clean energy. Thank you so much. I will then hand over to Betty.
Thank you so much, Nancy. Now, for us to be able to achieve the expectations from Ministry of Health and our mandate, even in that of reporting to WHO and regionally, we boast of a well-equipped a research team that consists of 15 research assistants. Amongst them are 4 interns. And this number keeps changing on the higher side because we keep getting interns to be trained and capacity built. This interns, the research team is so equipped that it is able to carry out data collection in an organized manner, and we are able to produce the best outcomes depending on our research objectives. Given that our lab operates under strict US EPA standards, then our team is continually trained on equipment, new equipment, and even the existing ones. We have robust systems for data management that includes proper documentation, completeness, and accuracy of our data. It goes down to the data analysis to make sure that our outputs are correct and ethically correct also. We have very good system also for calibration and maintenance of equipment to ensure that our data is accurate as we collect and report to the Ministry of Health or to any other body that relies on this health data. And we provide technical support to our teams every time they're in the field, whether remotely or even in person. So that is the best we can give, and I can hand over to Charles.
Thank you, Becky. In terms of postgraduate training, the Air Pollution Center of Excellence hosts a PhD training program that is mostly focused on household air pollution research. And currently, there are 3 funded PhD students who are taking research in various topics. For example, effects of air pollution on learners, models for transitioning households to clean cooking, and policy analysis on clean household energy. Apart from those 3 funded PhD students, there are also other PhD and master students who are attached to the center and who use the services and the equipment at the center to support their research. And some of their research topics are health effects of air pollution on informal food vendors. This one data collection is currently ongoing in Nairobi. Another student is focusing on household air pollution and pneumococcal disease, then air pollution in healthcare settings, and also emissions of medical waste incinerators, just to list but a few. In terms of the potential areas for collaboration, we have listed a number. And these are supporting the center in expanding to a center for climate change and environmental health research. And initially starting with activities such as holding the annual health and climate conference, which normally happens in October every year. Then also evaluating the impact of three short courses that were mentioned earlier, their impacts on the environment, climate, and health. And lastly, also evaluating the impact of Module 14 on household air pollution prevention training for community health promoters across the country, evaluating the impact of that training again on the triple benefits of environment, climate change, and health. The second potential area for collaboration is supporting an exchange program for master's and PhD programs that are accredited at the KEMRI Graduate School, which is one of the entities at the Kenya Medical Research Institute. The third potential area of collaboration is support holding joint research programs focusing on climate change and health. And the following areas are currently of high priority to our research group. First, interlinking climate, air pollution, and health data for early warning, prompt response, and reduction of disease burden. Second, impact of air pollution on mental health, cognitive performance in school children, type 2 diabetes mellitus, anemia, aging, malnutrition, STIs, and HIV, and pregnancy outcomes. 3, development and evaluating a national clean air model kitchen. And as was mentioned earlier, currently data collection is going on across 9 counties of the country, chosen to be nationally representative. And once that data is analyzed, it should inform the development of the clean air kitchen model. And afterwards, it should be piloted and evaluated to see whether it actually reduces exposure to household air pollution. Next is the development of Kenya indoor air quality specific standards. And this is a request from the Ministry of Health, which is our mother ministry. We also need to develop workplace PM 2.5 and carbon monoxide standards for 8 hours, setting the safe levels for 8 hours for health facilities, schools, prisons, eateries, and other workplaces. Next, there should be modeling studies need to be conducted to quantify the amount of firewood consumed, the equivalent carbon dioxide emissions and black carbon emissions, temperature increments or atmospheric warming, and the corresponding disease burden for the country. We also need to pilot the use of high precision, low and medium cost air monitors in households. And this can actually be deployed and used by the community health promoters, and their impact in reducing the disease burden needs to be evaluated. The other priority area for joint research is evaluation of clean cooking fuels, for example, bioethanol, and any other alternative clean cooking fuels that might be developed from technologies. There's also need to conduct research on the impact of converting animal waste into ethanol to reduce methane. And of course, methane is a greenhouse gas that contributes to atmospheric warming. The last priority area for joint research is the impact of converting municipal waste into biogas, again, to reduce greenhouse gases such as methane. The fourth potential area of collaboration is the area of innovation. And currently, our research group strongly believes that we should be in a position to develop low-cost air quality monitors, which can be deployed in large quantities across the country. The other area of innovation is the development of low-cost air sampling filters. As you may be aware, what is currently in the market might be too expensive, and the low-cost monitors are required. The fifth area is capacity building and health systems strengthening, especially at the county level. And Kenya has 47 counties. And within these 47 counties, there are government-recognized 130,000 community health promoters, out of whom only about 2,300 have been trained on Module 14 on household air pollution prevention. So there still remains a huge gap in scaling up the Module 14 training to cover the whole country. And lastly, there is a potential area to establish coordination mechanisms at the county level on household air pollution and climate change. And as you heard earlier, at the national level, the Air Pollution Center of Excellence is involved in the coordination mechanisms such as the technical working groups, but those similar forums or platforms do not exist at the county level. And for these coordination mechanisms to be established, there is need to have all the sub-county or district level coordinators trained on household air pollution and climate change. The seventh area, potential area for collaboration is the establishment of a lung function test unit within the Air Pollution Center of Excellence. This capacity or function currently doesn't exist, and it has to be outsourced. But there is a great need for it to support the research activities, especially on spirometry and linking that to air pollutant emission levels at households. The other area is modeling DALIs and CALIs associated with household air pollution. Currently, this has not been done for Kenya. 9, there is need to have rigorous testing of innovations for household clean cooking transition. And as you heard earlier, there is the Teachbox app that is used for remote training of community health promoters on household air pollution. Once it is scaled up, it needs to be evaluated whether it actually delivers impact. The other area is also evaluation of table banking. And for that to happen, there is need to train almost all the relevant community groups in the country before a rigorous evaluation becomes feasible. And lastly, there is need to build a national air quality monitoring network. And we can do this by the installation of reference grade air quality monitors in strategic locations across the country, maybe starting with the former 8 provincial headquarters. As we speak now, it is only Nairobi City that is covered in terms of ambient air quality monitoring. And unfortunately, the emissions generated from Nairobi City are reported for the whole country, but of course they are not a national representative, hence the need to build this national air quality monitoring network. And in addition to the reference grade air quality monitors installed strategically, they can be supplemented with additional air quality monitoring stations, maybe where we have low and medium cost air quality monitors deployed. And this can be at hotspots, for example, busy streets, industrial parks, schools, etc. That marks the last area of potential area of collaboration. And our last slide is on the contacts for the Air Pollution Center of Excellence via the email address indicated. And at this point, we are so grateful that you have attended the webinar, and I will turn it back to Anna Mendes for the moderation. Thank you.
Thank you. Thank you so much for this presentation and for presenting all this amazing work that KEMRI is doing. So for those in the audience, we have not a lot of time, but we have probably like 5 minutes to review some questions. So I don't see anything in Slido yet. So if you are in the audience connected and you scroll down through that, the link to the webcast that we were showing, below that should be a place for you to submit your questions. So please feel free to submit the questions, and we can maybe answer a couple of those. In the meantime, I do have a lot of questions. I think that this is really interesting, and it opens the door for a lot of collaboration. So hopefully in the audience there was people who will contact you and discuss further. One of my questions that I have, I think it was like from Gohole side of like the slides. There was, I think, a picture of one of the research. I think it was like it was titled like research efforts, and one of the pictures was a woman with I think it was like a monitoring device in a house. I don't know if could you explain a little bit more on like, yeah, exactly that. Like, could you explain a little bit more on like is that what is like a monitoring, like how often observations are taken? Like, this is, I think, a really interesting way of also like engaging the communities, right? The citizenships to be part of the monitoring and like help collect the data. So if you could explain a little bit more about those efforts and the data collected, because I think it's really interesting.
Thank you very much, Anna. Human beings require food all the time for them to survive. And for this to happen, cooking has to take place. And it takes place mostly at household and in institutions, including learning institutions where our children must spend almost half of their teenage life, or let's say half of their life, youth life, trying to acquire education. And the people that tend to suffer most of the time, especially in Kenya, even as you see those 23,000 deaths, you may find that the cooking activities are being undertaken by women most of the time, and children who remain behind. And also the cooking that takes place also in these learning institutions, you'll find that it's women who tend to do this most of the time, unless it's preparing meals that require a lot of masculinity. And the question was, if women are suffering a lot and the children, what is it that we can do to reduce these cases of low birth weights, these cases of miscarriages, these cases of respiratory tract infections? Kids are not able to focus in school, even at home when they are given their homework, because of the kind of lighting they are using or the cooking event that is taking place, be it the use of biomass or the use of biomass or kerosene. So our initiatives are targeted aimed at targeting these main cooks in these households, whereby if we are targeting a household whereby we go as by the WHO standards for 24 hours, and for that, it means we give the cook that apron that you can see, specially designed to accommodate the UPAS and the LASCA. With this, we are able to collect PM 2.5, nitrogen gas, all these gases before we can take them to the lab for analysis. And apart from just sampling this, we take that opportunity through our research assistants and the network of community health promoters to be able to pass the messages on the advantages of transitioning from the dirty fuel to the clean fuels, and also how to maintain a good air quality within their households. The same goes also to the schools, whereby the board and the top management are involved so that they can see the importance of transitioning their schools from using the biomass, which we have seen that it's affecting the students, to cleaner energy options. Thank you.
Thank you so much for this answer. So we're sharing the screen now because we have an online question that I'm going to read, and you can decide who wants to answer. So Marlene Decker says, "Thank you for an excellent presentation." I second that. I agree that this was excellent. Could you tell us a bit more about the air quality measurements? I recently learned that SEI, I don't know what that stands for, but hopefully you guys know. If not, Marlene, please just let us know. Also monitors in Nakuru. Is there a national network operating, or does the monitoring take place in local networks only?
Thank you. Thank you very much. SEI stands for Stockholm Environment Institute.
Thank you.
Which is the house at UNEP here in Nairobi. And it's good he has mentioned SEI. That's one of the partners that we are working through the Ministry of Environment. And as you have seen, our focus has mostly been on the indoor air pollution. And whenever we go to the ambient, we are looking at how it's contributing to indoor air pollution. So with SEI, they have been also conducting a lot of activities, but mostly on ambient air pollution. So we are building these synergies, but working together so that on all the initiatives, all these standards that we are coming up with, they be harmonized so that we speak the same language, irrespective of the ministry where we are coming from. But on the last question on national network operating, or does the monitoring take place in local networks only? Yes, that's true. Currently, it's happening in local networks, whereby you find that just individual institutions undertaking this mandate. And that's why at a center, you can see we have a lot of interest in developing a national real-time database whereby we can interlink directly with the health indicators, because this has been missing. And we have said that the concentration has been in Nairobi, and yet we have 47 counties that we need to cover. So that's 1 out of 47, meaning there is a lot of work that needs to be done in order for us to meet the WHO recommended standards on air pollution. Thank you.
Great, awesome. Thank you very much. I think that Marlene was also like, thank you. Saying thank you to also to the response. I don't see any more questions in the Slido. So, and we are just at the end of the hour. So I want to appreciate again your contributions here to this seminar. Hopefully there's more people who will contact you in the future for further collaboration. Also for the audience, this is going to be uploaded to our YouTube channel. So if you want to share it, or you want to review that and contact the team later, so that will be posted. And just I hope that the holidays are coming, so hopefully people is having a good time, or at least at the very spending a good time at the end of this year. and we'll resume the seminars in the next early next year, and hopefully with more interesting talks and more collaborations coming in 2025. So thank you so much to the KEMRI team. Thank you so much to the multimedia, to Fletcher, who was helping us from the multimedia team, and thank you for the audience to be here with us today and for the questions. So yep, that's all, and I hope you all have a wonderful day and a wonderful rest of the year.
Thank you. Thank you, and bye-bye.
Thank you so much. Bye-bye.